I'd like to introduce our next speaker. Ken Hayes is someone that I've had an opportunity to work very closely with. He's been a project management professional for a long time. He also had a range of organizational experience with other companies before he came to Eli Lilly. If you talk to him, he's an avid Butler basketball fan. Go Bulldogs. Ken has been part of the key leadership role in the Eli Lilly implementations of TOC portfolio management or critical chain project management. They have had a long-term engagement in putting this in place, not only in product development, but also IT. Ken is one of their experts. He helps train other experts. He has helped continuing to lead their effort as they continue to drive focused system improvement and getting results out of TOCPM to really drive success for Eli Lilly. Would you help me welcome Ken Hayes?
Thanks. Is it up there? Thank you. Everybody hear me okay? I assume? There we go. Okay. How many people heard of Butler University before about 2 years ago? How many know who Butler University is now? Come on, basketball fans. Okay. Actually, it was at Butler when I was getting my MBA that I first learned about TOC. I got to read the goal in an accounting class. I got to read the goal in an operations class. And I was asked to read the goal in a leadership class. Full transparency here, did not read it the third time. It's a good book, but come on, it's not that good. So I have been doing project management for about 20-some years, the most exciting of which has been the last 7, which is when we started doing the critical chain thing. And that's kind of what I want to talk about today is our journey, where we started and where we are today. In case you stayed out real late last night at the casino and you can't pay attention during the whole thing, I'd like to take away 3 key points. One is, if you're going to do some large-scale implementation of TOCPM, or what we call CCPM, Critical Chain Project Management, don't underestimate the organizational change management required to be successful. 2, don't underestimate the possible impact to your company if you are successful. Guilty of both. And 3, don't try to define done, because what I found during this whole thing is we just keep going. Once you start this theory of constraints thing and you start going, you just keep finding more ways to do things better. So it's a great journey that I don't see a completion date of right now. So that said, for those who don't know Eli Lilly and Company, this is right off our webpage. So we make medicines that help people live better lives, longer lives. Insulin. Anybody heard of Prozac? Cialis, the bathtub commercials, that's Eli Lilly. Very proud to see that Super Bowl a couple years ago on commercials. And our current scope of the critical chain implementation is actually IT and our product development organization, which we call LRL, Lilly Research Labs. And those are our current, where we focus our critical chain implementation. So our journey started about 2004, 2005. Where someone came up to me and said, "Hey, Ken, do you know anything about this critical chain stuff?" And I said, "Well, not really. Read a book, The Goal. I know a little bit about theory constraints." So a couple of us started sitting in enclaves once in a while, drawing pictures and trying to figure out, what is a feeding buffer? What do you do with this thing, and how does this all work? Well, we kept reading and kept trying to learn about this stuff, and we eventually decided, hey, we're going to start a pilot. We're just going to give this a shot if we can find somebody to either be brave enough or dumb enough to put their neck out there. So I volunteered, and our first implementation was in our device test area IT. So a lot of the medicines we can't take, as a pill, so you have to have a device, a pump, a pen, a needle, that kind of thing. So it's a big part of our company is these devices, many of which have to go through very stringent testing on equipment that, of course, is driven by what? By software, right? So that's where the IT component comes in. Our goal was obviously to be aggressive with our schedules, but really what we were after in IT was credibility. You guys have read the stats on IT completion rates and over budget rates and all that kind of stuff. Ours was no different than anyone else. So we were after credibility to our customers being, different parts of the business. The pilot went about, well, actually it went about 8 months before the IT folks said, hey, this is going well, we like it, this is what we want to do. We're going to roll it out to further into our IT organization. And at this time, our IT organization was scattered. So we had sales and marketing IT over here, we had manufacturing IT, we had European IT, it was all kind of broken up. And these first 3 areas is where we started. We started in sales and marketing, medical, manufacturing. Same goal. Aggressive schedules was important. The credibility of delivery was what we were really after. We asked our CIO at the time, I'll call him Mike, because that was his name. We said, Mike, can we just tell the leaders of these organizations that, hey, this is what we're going to do? Because if you tell them we're doing it, they'll buy into it. And he promptly said no. He said no. He goes, I want you guys to be successful. I want this to be a pull. As you do these and are successful in projects, I want my managers to want to do this. I want them to want to do the next project this way. So the 3 of us, we had 3 of us were expert certified at the time to drive this implementation. We had 2 concerns. One, what if no one wants to try to do it? You know, a lot of training, we're experts, this is fun. What are we going to do with it? Our other concern is what if they all want to do it really fast? Well, fortunately, we had the second problem. It became real obvious that the people who were doing it, the projects that we were laying this out, it wasn't just that we were meeting credible schedules, but the people doing the work loved it. The people, the engineers who knew all along that they were a constraint and kept yelling, hey, too much, too much, too much, I can't do all this work. Now we had schedules and we had data to reflect that and we could manage our work accordingly. So the people on the teams loved it, the leadership loved it, we were delivering on time, and it just grew, and it grew very fast. 2007, IT says, okay, we're rolling this out to our global organization, all of IT. It's a done deal. Here we go. 3 experts. So we started the global rollout, which for me personally was probably one of the most fun times in my long career in IT, because every country I would go to, I got to hear all the reasons why CCPM won't work in their culture. You know, why it won't work in Italy, why it won't work in Germany, why it won't work in France, et cetera. So that was kind of fun. Needless to say, we got past that, and they were all using it. It was also fun to have them all in a group. I had a network build, a schedule build one time, where I had 9 people from different countries all in this one schedule build. And it was so funny to hear the people in Germany, you know, talk to the people from France about their estimates, you know, and vice versa. Like, why does that take you so long? You know, why are you people in France so slow? And we had all those conversations. At the same time in 2007, the leadership in IT was having constant conversations with the leadership in our product development area, and they were saying things like, if we've seen this impact in IT, what's the potential in our drug development chain? I mean, we're big on calculating the value of a day for a project. So not only do you have this buffer out here, but what's the value of bringing something in a day faster, a day sooner? In IT, we had some pretty sizable numbers for the value to the company. Well, think of a Prozac, if you will. What's the value of bringing that in a week earlier, a month earlier, 6 months earlier? I mean, it's phenomenal. So we decided to do a pilot in product development. It was to be a 6-month pilot. After 3 months, the vice president called a timeout and said, we're done with the pilot. We're doing it. I've seen enough. After 3 months, now we barely had time to get some schedules built and people executing, and they already saw improvement. They already saw some processes that we found were broken. And as we went through this process of identifying the constraint and so on, we made improvements to those processes, and we're immediately showing value. So we went to an all-out accelerated implementation in 2008, 2009. So think of our IT organization at the time as about 1,800 people globally, 1,800 employees, not counting vendors, contractors, partners. Think of that, move that into our drug development organization, which is much larger, much more expansive globally. It was a huge implementation. Think of it in a so someone would ask, how could you take 2 years to convert your portfolio into critical change schedules? We had to build templates or modules for all these things. We had to try to get the teams, if you were going through a phase of, you know, I'll just pick a phase 2 clinical trial, we had to come up with a module so they're saying, hey, here's kind of what it should look like, and if you're doing something drastically different, we need to talk. So there was a lot of work there. And what we also realized during this time is that we were spinning up some more experts like myself to help drive these builds and train people. But looking back at some of the IT projects, what we realized is there was a gap in execution. So we were handing these projects to project managers and teams saying, hey, here you go. You guys built this network. Go execute. You know all the rules. And there were some struggles. Well, the project managers weren't really trained enough on the behavioral aspects of CCPM. How do you drive this? How do you convince somebody to go for this aggressive estimate? What are the right behaviors? How do you account for variability down in your schedule? Well, some of these project managers didn't have the training. So we went to a second level of certification at this point. We had our experts like myself, which I hate using that term in this group. I don't feel like an expert sometimes talking to people like my new BFF D over here, So, but anyway, we had two levels of experts being trained here. And we also put together some enabling projects. Our LRL organization is so big, we had to put together projects like, okay, how are we going to now take this information, this buffer information, and put these into our system data? How are we going to put, where we used to put a date, let's just pick product launch as a date. We used to stick a date in the system. Well, now we've got this thing called a buffer. What date are you going to put in there? You're going to put the fully buffered date, the aggressive date, please now. So how are we going to do that? So we had system issues to take care of and to try to build around this concept. We had people issues, of course, in training. So we had multiple enabling projects. One of the most fun parts for me was the integration with Six Sigma teams. I'll talk about this a little bit later on, but as we would identify constraints and processes, we've got a strong Six Sigma presence at Lilly. Well, I'm not, as a project manager guy, I'm not going to try to figure out how to fix this constraint. I'll identify it, and then I let it go to the Six Sigma guys. You figure out this process, whether it truly is a constraint or if it's something that we can work on. And then we started with our first company-wide critical chain symposium. And the reason I mention that is because, as you guys are aware, if you read the papers, pharma companies are like everybody else. Times are tight, money's tight. It's not this, we don't have a lot of money to throw around anymore. And they still take the time and effort and spend the money to put together this whole day symposium, something similar to what we are today, except all internal with our project management teams and their leaders. So we spend an entire day sharing learnings, things that we've learned over the years, issues we're having with either the processes, the tools, or whatever. So we did that. 2010, we had our second symposium, and this was actually a good time for a couple of us to kind of peek our heads up above this training and this network building and this conversion of schedules to say, okay, how are we doing in all these different aspects? And we quickly identified some gaps. So this is when I made a call to my new BFF over here, D, and explained my situation as staff. And I said, where should we go? What are some hints? What are some things that you guys do differently? And she invited me to this technical expert training. At first thought, I thought, oh boy, more training. But she told me this concept of this training being with no software whatsoever. So I thought, okay, if it's no software involved, we'll pick up some tidbits and get back to the basics. A lot of stuff we learned there. Myself and another buddy of mine, Tom, we went out there and we picked up a lot from D and AGI. We then took that and put together in 2011, we put together, working with D, a class that we could now deliver to our experts. So now we've got about 24 what we call launch experts at Eli Lilly and Company, 24 people that should be able to go in any part of the organization, teach this stuff, launch projects, help them get ready to execute, 24 of those. And we took them through this 3-day course that we called our Advanced Portfolio Training. At the same time this was going on, this was mostly for the drug development side. Same time this is going on, IT has a big reorganization, of course, going from 1,800 people to about 1,200 employees. And while the numbers seem daunting to me, the key is that a lot of knowledge left and went to other places as they looked for different places to work. Secondly, they replaced a lot of these people with more contract work, more people coming in to do project management stuff for us. So where does that put us back with our training and stuff again, right? Here we go again, more training, more influence, and trying to influence the critical chain movement. And still focusing on execution. That's our focus for 11. 2012 is the same thing. We're focusing on our execution of these plans. We can build some pretty good plans. And some of our plans are very complex. If you think of the drug development process, you hear these horror stories on how many years it takes. Well, it's true. Our critical chain part starts at what we call candidate selection. So when molecules have gone through enough scientific discovery and stuff to think, hey, we've got something here that's worth investing a lot of money in to take forward, that's where we start using the critical chain tools. That's where we build our schedules, all the way through product launch. Could be 8 years from now, could be 7 years from now. For an example, we just had to change our project calendar to go beyond the year 2020 because our calendars, our schedules go past that now to get the product launch. So it is a long life cycle. In 2012, we're having our third symposium. It was supposed to be in 2011, but because we are a company that really strives on prioritization, that one got deprioritized on us, so it'll be next year. We're going to focus a lot on our resource modeling and management. We found various people across the globe doing things differently. We're looking for some consistency here. We're trying to drive the whole concept of synchronization back into some of these areas. With IT coming together as one big central group now, suddenly they don't have all their little pockets of people to work with. They have one bucket of people to work with. So synchronization of schedules across the IT portfolio has become very much needed right now, so we're focusing on that. Someone mentioned the culture and changing the culture. When we started this critical chain thing 7-some years ago, someone said, it will never work at Lilly, don't you understand our culture? So I said, well, first of all, I'm relatively new at Lilly, and no, I don't understand this culture. I said, but I'm not trying to change the culture. But we did. And I read a book that said, if you change the culture, if you've changed the language used. So if you listen to how people talk in the hallway. And these are things that you hear all the time now in our environment. If you're in a cafeteria having coffee, if you're walking down the hallway, someone will talk about the network builder next week. We've got 2 rooms set up that are just for doing network builds, just for building schedules. And you can walk by there almost any day of the week and you see this wall peppered with PERT charts or network diagrams. And there's a team in there working on a network build. At one point in time during our implementation, LRL, quick story, I was invited to one of these meetings that I don't get to go to very often. It's got a bunch of real important people, people that don't like to spend a lot of time with me. And so I'm expecting to hear this thing that says, yeah, critical chain, we're on it. This is really working. And the first thing the senior director says, I'll call her Janelle, and first thing she says is, we're going to announce to the organization that critical chain is not our project management methodology. And my heart just sank. I said, you got to be kidding me. This is a lot of work. She said, no, we're going to call it an operating system. This is the way we at Eli Lilly are going to work, period. It's not just a project management methodology. This is how we operate. Our CEO has referred to critical chain as our operating system. Our IT people don't like calling it an operating system, but they'll get over it. So we did make a change to the culture. I mean, we have better planning from the network builds. Our focus time, which seems like such an easy thing to teach, and yet so difficult to really drive through. The relay race mentality. Early on, people were getting the hang of this relay race, the relay runner, handing off tasks, really getting excited about it, making a lot of progress. We had one project that they actually gained enough ground on their schedule. They called their clinical research organization, which I think was in South America for this one, and said, hey, we're 6 weeks ahead of schedule. You guys can start enrolling patients next week. And they said, hey, would have been good to know a few weeks ago because we don't have anything reserved in the hospital and stuff until 6 weeks from now. We're locked. So yeah, we made great progress, but due to lack of communication and the handoffs involved and required for a relay race, we missed an opportunity. So lessons learned, picked up on that. Less multitasking, eliminating waste, this kind of thing. We always have this thing going against us at Lilly. We are in what we call an integrated workplace environment. None of us have cubicles. None of us have real phones. You get there in the morning, you go to whatever part of the buildings or corporation that you need to be at, pull yourself up to a little spot, you've got monitors and stuff, hook up your laptop and you work away. It's a very social type environment meant for knowledge sharing. There's a lot of good intentions behind it. Really makes it hard to focus on doing things for any length of time because you're right out there in the open with everybody. So we're working on that one. And of course the buffer and risk protection, better learning how to use that. And our fever charts. And I'm going to show you an example of a fever chart here later that we use in case you're not familiar with it. But the fever chart for us is just your first point of conversation on any project. If you're running a project in IT or product development at Eli Lilly and Company, and you don't have a fever chart, well, you don't have a project. I mean, you're not even going to have a conversation about it. You got to have it. Okay, some key principles that drive us are transparent, proactive communication. Again, seems pretty simple. We really make an effort to document realistic assumptions when we build our plans and communicate our plans. Again, it doesn't seem like a big thing, but you'd be surprised how far you go into a project and execution before people realize, oh, well, that assumption's not true anymore. Okay, so we drive on that. Stable priorities. Early on, we learned that you are better off to prioritize incorrectly than to not prioritize at all. And people always seem to be aware or had a fear of prioritizing. You know, the IT leadership would say, well, you know, all the projects are important because it's number one for this guy, this one's number one for this person over here. Well, you got to make a call. I've got people on all these different projects. I need to prioritize them. So sometimes it would get down to someone like myself, and we just would make a call and prioritize it. If it was wrong, but it was still better. We were still making better progress on our projects until we realized it was wrong. Fix your prioritization. So that was a difficult one to get started and get through, especially on the IT side. Realistic commitments. Again, it was about credible schedules. It was about knowing where your variability was in the plans. This is something that is easy to talk about and easy for some of us to grasp, but for some reason, a lot of project teams just don't want to identify it. They don't want to grasp it. Leadership early on in the product development side made what I call one of our classic mistakes. They had a high priority project. They built a schedule, got this buffer, and they said, well, this is such a high priority project. We'll give these people anything they need to execute, resources, money, anything. So they don't need all that buffer, right? So what we're going to do is we're going to take like 80% of that buffer away and make sure that this team can just execute. Well, it didn't take long before, you know, that little 20% of buffer was gone due to variability in work, due to some things happening. And to this day, I have one of my friends at Lilly, a vice president, will roll her eyes at me and say, oh yeah, Ken, I remember you arguing about that. So lessons learned. And the relay race thing, we've tried lots of different tricks to get it to work. We've tried lots of conversations. This is a never-ending effort to get people to really work this way. It is hard. It is really tough. I was on a project where I was the SME, I was a subject matter expert, I was a project manager, I was part-time tester, while doing my work as an expert. So it's kind of hard to, you know, run the relay race and all these things. It's all about prioritization. Just real quick, I don't want to spend time on this slide because you guys probably know a lot more about Six Sigma than I do. But our goal was predictable delivery and reduced cycle time, whether it was IT or drug development. That's the goal. And we will leverage both our critical chain tools and knowledge and our Six Sigma tools and knowledge, and we'll put these together, and it is fun. We'll take Six Sigma swim lanes. That used to look like the top left, and it ends up, we can compare that now to what ends up being our project network. And you can kind of look in there and see if you knew the project, you could pick out the bits and pieces. The key to this, so for me, was to help enable the Six Sigma teams to make sure they're making process improvements in the right spot. It doesn't do us any good to improve that spaghetti mess in the middle if that's not driving our timeline anyway. I mean, yeah, it'd be great to make some improvements, but that's not where we should be focusing on. So we've had a lot of good integration with Six Sigma in the critical chain effort. It's an iterative process. I was talking to somebody the other day about this. This is obviously a very small piece of the network, but I was asked to go to work with a clinical research organization, our Six Sigma team, their Six Sigma team, and some other folks, and figure out why our process, from what we call protocol approval to first patient visit, was so much longer than the industry standard. So we took our process, built our critical chain, said, okay, here's the longest pole in the tent. Six Sigma teams, and this was like a 2-week effort of about, I don't know, 16, 20-hour days, it seemed like. And then they would work on the processes and work on trying to figure out how to get some time process improvement out of this. Some of it you think would really be hard and complex, but some of it was really easy. We found things like, well, that box, that task, that doesn't even belong in this process. Why is it here? That can be done later or a different place. So we made a lot of improvements, and what we did here, this iterative process, is we'd make some changes, rebuild our network, make some tweaks, and suddenly you're looking at a different critical chain, right? And we do it again, and we do it again. And this was fun for me, because first of all, I learned a lot of detail about the process and protocol approval to first patient visit, but to actually see the Six Sigma teams in critical chain work together like that and work really fast. So what we had seen at one point is this, and I apologize for not having a lot of statistics up here on what we've done. Some of that information I'm not allowed to share, especially around product development. I can tell you that in a time when pharma companies are cutting back left and right, including Lilly, our PMO and our energy towards critical chain has not dwindled at all. You know, I get to come here. We're always after learning more and getting better at it. So I can share with you that there are different benchmarkings with different pharma companies on lengths of processes. So I mentioned protocol approval to first patient visit. We rank ourselves amongst our peers. And some of those, out of 13 pharma companies, we were hanging down at 11 and 12 as far as length of time. And on some of those now, we're up at 3 and 4 in our process times. And that's time that we've tracked and proven, not time that we're hoping to get out of it. So we have made some great strides in our process time. So IT had a couple areas that actually hit 100% on-time delivery, so they told me. And I looked into some of their data, and I kind of disputed a couple things, but I'm happy to say 90%. Where they struggle now in a new organization is how do you do this with all this contractors and vendor integration? I mean, we've got large parts of our IT business that are now run by IBM. Large parts of our outsourcing stuff run by TCS. Well, you have a choice. Are they going to play in the critical chain space? How are you going to integrate them into our world? And so that's the part that they're working on now. The other thing, of course, is the WIP. They just keep firing off projects. We're down to 1,200 employees from 1,800, and the number of projects out there hasn't decreased. So we've got some issues there. The LOL side, they did a great job of embracing the behaviors. I actually got to meet with the CEO for about 2 hours a couple years ago. He sat down with 3 of us, and he drew up on the board what he thought critical chain was all about, and what he thought issues were around constraints and stuff. And what he drew, we could almost take and put into one of our training slides. It was so close to the way we're training it. So our CEO gets it, which is quite impressive, at least I thought. Great process and decreasing times. One of the things we have in our organization is it's very large, and the training never ends. We continually have, over 7 years, you're going to have people leave the company, leave the organization, new people come in. We also have this rotation thing in LRL where we don't want people in jobs for much longer than 3 years. We want them to grasp this part of the job, move on and grasp another part so that their knowledge base is across LRL. Well, that's great, but then you get new people coming in. Did I hear something? Oh. New people coming in, you get to train them all over again. So that's an issue. And the complexity of effort. One of the plans I just helped a team with the other day is a program file and 5 sub-projects. It's 8,270 tasks. And just besides the volume of work in this network, it's the complexity of dealing with clinical research organizations across the world, manufacturing plants across the world. So it's a very complex projects that we build. I don't expect you guys to read this, and I'm certainly not going to read it. What I want you, if you just glance over a few of these, what I want you to consider is a lot of these lessons learned is all about building our modules, getting our teams going, and during that 2008, 2009 period. And my point here is that we can plan. We can really plan. And now we're all about trying to execute. The one bullet here I do like is the 4th one down, though, that says, we built these modules on pretty aggressive times, and we found some teams that were actually going faster, which we thought was pretty cool. But then what happened to our modules? So we have to keep tweaking our modules. And of course, the challenge is the one on the bottom. Challenges with integrating partners is really tough. Okay, so move the clock ahead to 2010. This is a fever chart, by the way, for anyone who hasn't seen it. Across the bottom, you're looking at project or your percent critical chain complete. Going up, your buffer consumed. What we found is that a lot of people really thought that these are identical. And that if you were, I think I have a pointer in here. Yes. If you were up here on each project and both projects are in the red, both projects need escalation, and we just need to throw the stuff and recover. Well, the question is that really true? And this is where we're working with AGI, and Dee's sharing with us this decreasing size buffer management practice that we were really able to help teach this differently. And I was excited to look on the program to see you guys have a breakout session on decreasing size buffer management. So the question is, do they both need recovery plans? If you've got a bunch of IT projects in the red, you just throw resources at all of them? How do you decide? And if so, how much? And then, of course, just for give you guys some data here, I'm pretending at least that there's 50 days of buffer on this project, 10 days are left, okay, on both projects. So the key to this, if you look at the remaining tasks, and I tried to make a simple example here, Project A has got 2 tasks left, very little variability. There's a stability test where the IT guys say, you know what, it has to sit in our environment for 20 days just to prove it doesn't break anything else. I always question that 20 days, but anyway, that's what it is. No variability in it. We're not going to let you go any faster than that. We're not going to take it off earlier. You don't have to go past 20 days. The second one is a report creation thing, a little bit of variability there, not much. Second project, though, tons of variability. You've got software development for one task that says it could be 20, could be 40 days. We're really hoping for the 20, but boy, it just depends on how the requirements came at us. And then testing. And then we're at the testing, and the testing says, well, we're hoping for 20 days, but it depends on the development and how that works out. So a lot of variability in these two. And so when you get back to this at a high-level view, Project A, all their risk was at the beginning. So, yeah, they're sitting up there in red on the fever chart. That's okay. What they really need is about 10 days of buffer. And if you look at the little bar on the right here, they got about 10 days of buffer, so we're fine. So there's no reason to escalate on this project. Yet I will see from our IT leadership these emails coming out saying, hey, we've got 12 projects in the red. I want to know what we're doing about them and how we're going to get them out of the red in 2 weeks' time. It's like, well, for Project A, we're not going to do anything to get out of the red. It's okay. For Project B down here, however, we're hurting. We could take as long as that 40 days and consume 40 days of buffer, and we've got a whopping 10. So the key here is knowing where your variability is in your plan. And when we took this concept back to our experts and started training it, boy, we learned a lot about how they were building some of their plans. A lot of our PMs, I shouldn't say a lot, a couple of our PMs, to avoid this situation, they just assumed consistent variability throughout the schedule. Every project had the same amount of variability. Every task had the same amount of variability. So their plans weren't reflecting reality. So the other thing that came out of this was something that, guilty here, our buffer recovery plans were kind of weak. So I would have buffer recovery plans when I was managing a project. Never, ever, ever in any of mine, I go back and look at them, did I say, here's the number of days I'm trying to recover. I just wanted to recover something. So by using this process, I can tell if I'm in Project B, I got 10 days of buffer. That's not enough. Be great to have 40. That's almost going to guarantee delivery. But I want to at least try to get somewhere in between, the 26 and 40 mark. Get me up in that green area. Give me an opportunity to succeed. So then I thought, well, I'm pretty weak on my buffer recovery plans. So I assume people who I have taught are probably fairly weak on their recovery plans. Come to find out as I start questioning and teaching this, most people didn't even have buffer recovery plans. So when this project is going up 6 days in a row or 6 weeks in a row, there you see them going from yellow up to the glowing red. First question I asked was, well, what did the buffer recovery plan look like, for Project B? Oh, well, we were hoping for this and we were hoping for that. So we now have a little bit better process on our buffer recovery plans. So obviously, Project B has more variability. Here's what we learned from that. I think I probably talked about most of these already. How many days to recover is huge, should be huge. And the other thing that I'm trying to get through, and Dee was great at helping us see this and come up with ways to teach it, is you build this schedule. And some IT plans could be 12 months long. Some product development plans could be years long. And you make assumptions on variability in work that is way out there. Well, as you progress through your schedule and those assumptions change, update those tasks. We've got this thing that we call a 4-week look ahead, where project managers are looking at what's coming up in 4 weeks, what's about to get my critical chain, what is on my critical chain, how are we doing this in 4 weeks? That's great. It's a great execution tool to keep people focused. The next step should be where we are now in our schedule, what have we learned to modify some of those tasks way out there that show a lot of variability or no variability. Lots of gaps. So we're working on that one. The other thing I want to talk about real quick, and I'm not going to put the formula up here, even though I love to put the formula up here because it's, it's so cool, is iteration variability. So think about IT, we've got iterative development. And one of the questions is always, okay, we know we're going to go through 2 iterations, but we may have to go through 3, we may have to go through 4, we may need 5, we don't know right now. So how do you model that? And what we found is we had some very creative project managers. We modeled it in some really cool ways. Some project managers would hard code every possible iteration that may ever happen, because that way they're covered. They've got plenty of buffer. If they can sell that to leadership at the beginning, they've got a lot of protection in their plan, which is not the right way to go. We had other ones who said, hey, it's in our risk plan. We know there's going to be 2 iterations. It could be 5, so those other 3, it's a risk. And they didn't model it at all. And we had all kinds of variations in between. So what we did now is we came up with a consistent modeling in IT on how to model these iterations. And not that it's the perfect way to model it, but it's consistent across projects. So if I'm modeling iterative development in my plan, and you're modeling it in yours, management knows it's being done in a similar fashion. They understand what happens if all of a sudden you say, hey, we didn't realize these 3 other iterations, so we're going to we don't need all the buffer that was requested for that, and they can understand why. So it's all about, and if you think about it in the drug development side too, people think, well, that's great for IT. What about drug development? Well, we don't know sometimes when we send something to a government body, say FDA, for approval, we don't know if it's going to come back the first time and say, hey, that's great, Eli Lilly. We've got nothing to say to you. It's perfect. Chances are they're going to come back and say, we need more information on this. We need data on this. Is that going to happen once? Is it going to happen twice? Is it going to happen 3 times? We don't know. And so we model this variability now in our plans, and we do it in a consistent fashion. So my survey says thing here. These are just some bullets that you should know that is required for all this to work. All right, seems pretty simple. We have support at the leadership levels. No questions asked. We have trained the resources on the grounds and the PMs and the teams. This is how it works. No problems whatsoever. Where we see issues is right there in that middle that says resource managers. So think about it early on in IT. You're a resource manager and you're in control of who's working on what at all times. You're the boss. Now you've got this Ken Hayes guy saying, hey, my plan says I need this guy now, not next week, and I don't need this person until 2 weeks from now. So I'm kind of playing in their sandbox, and they don't like it. So we've got some issues in there, and we're trying to work on that. People at Lilly, like I'm sure at your organizations, they want to be successful. They want to feel at the end of the day, did my job, did it well. Their manager comes up and says, I really need your help on this. I really need you for 2 days. Just focus on this for me. Well, yeah, buddy. I can score some points with the boss. In the meantime, that task I'm supposed to be working on kind of gets shoved to the side. So at one of our symposiums, I think it was 2 years ago, I raised the question. I said, how many people, so think of a room about 250 people. I said, how many people, either individually or on your teams, have been rewarded for saying, no, I can't do that for you right now. I'm on a critical chain task. Guess how many hands went up? 0. I was surprised. I expected a couple brave soldiers. So then, though, I didn't stop with that. I didn't blame it all on the management leadership. I said, okay, show of hands, how many of you people have actually, or people on your teams have actually said, no, I can't do that for you right now. I'm on a critical chain task. Guess how many hands went up? Like 3. So if the resources aren't saying, I can't do this right now, I'm trying to run this relay race, I'm trying to follow these behaviors, if they're not raising the flag, how is leadership supposed to know there's an issue? So we've got a communication thing that we're working on in there. And Dee calls us the signal makers. Like, who's the signal maker there? Well, to me, the first signal maker is the resource. You've got to raise your hand and say, I can't do it. I'm not doing this for you right now. They may tell you to do it anyway, but at least they'll understand why you're saying no. Second signal maker could be the resource managers. What is important? What am I going to be rewarded for? What behaviors? And, I don't want to go there yet. The other thing that I found really valuable is when we took our experts, some of them have been doing this for 5 or 6 years, we took them through this training that we built with Dee, and we had them moving tiles around, making them build a critical path plan, making them build a critical chain plan with little tiles and stuff. I really expected a lot of pushback from these folks. Like, you know, who do you think you are, making me go back to the very basics. It was awesome. I mean, these people came up with questions and stuff they didn't realize, some things that they're seeing differently. When we got to the point about synchronizing schedules, some of the same leaders in project management on the IT side who said, we don't need that, we're suddenly asking, why aren't we doing that? And so my point there around this continuous process improvement in this whole journey is that sometimes to get the points across, you have to go back to the basics to get the point across. It's knowing when to do that. I went really fast. I was afraid I'd run out of time. Questions? Because I could tell more stories. No, I'm just kidding.
Again, if you have any questions, you want to come up, come right up to the mic, please, and so we can get it on tape. Come on up and don't be shy.
These are the easy questions that we planted, right? That's what you promised?
No, these are not the planted questions, Ken.
Okay.
Hi. I see on your last chart, you said it's very important for the senior leadership to continue to support and reward the efforts. How did your senior management reward those efforts?
Really good point. A lot of it's just by publicity on our side. I mean, you can't, you know, just throw money at people for doing things well. A lot of it's publicity. So we do a shared learning quite often in our organization, especially on the LRL side, that will bring a team that has done something well. Hey, we identified a constraint, we changed the process, we found something, and this worked for us. We'll publish that. The team will get some kind of a verbal or written, hey, this is how we need to model things. That's one way. The other thing we're actually trying to do, we have something called our individual performance plans, like, you know, from year to year. And the company always says, here's some of the things that you need to model, some behaviors you need to model. And if you look at those behaviors along with respect for others and this kind of stuff, now you'll see some of the behaviors required to live in a critical chain world. So it's actually in our performance plans now in some cases.
Other questions?
Yeah, what tools did y'all use to develop your buffers and your schedules and produce your fever chart?
We use ProChain. Product is ProChain software. It's a critical chain software. It's got a client side and a web side. So the client side is for the project managers to actually build the schedules and the networks and model and create the buffers. And like other softwares, there's, you know, you can tweak and set configurations to do it what you're looking for. And then for us, for the execution side, is the web-based tool. We've got about 7,000 users now globally that actually go in and see their tasks, update their tasks. One of the behaviors that we really drive is for individuals to update their own tasks. No one's too important to take 10 seconds out to update your own tasks. I will tell you I've gotten pushback in the past from my favorite one is a physician in France who after 20 minutes of explaining to me how much money he made, how important he is, I explained back to him that in that 20 minutes he could have updated tasks for the rest of the year. I mean, it's just not that much work. But so, yeah, that didn't go over very well. But the point is to get to, I mean, one of the keys to success is that people that build these networks understand their plans, and for them to make the updates is important. They're the only one that's going to understand that if the variability changed in their tasks. They're the only one that's going to know what the real remaining duration is. So we really push hard for that. And that's done through our web tool. I'm sorry?
Frequency of updates.
Yeah, our frequency is currently weekly for both IT and LRL. It's worked real well for us. Now, some IT projects, if they get close to a go-live date, some of them will go daily. You know, if you're 15 days out from a go-live and this is a global rollout, you are really held to the 15 days at the end. They'll actually go to a daily buffer update to just keep track of everything. But for the most part, we stick with weekly.
Other questions? Come on up if you have questions. Don't be shy.
Thanks for your presentation. I'd like to take you back to your pilot. Mm-hmm. So when you started launching your pilot, did you have the resources that were involved in that pilot focused strictly on applying CCPM principles, or did you have them with one foot in their kind of current world, doing their day job, and the other foot in, okay, I'm going to try this new methodology?
Yeah, that's an excellent question. Ideally, we would have had them just on the critical chain project, but even myself as the leader of the pilot and the project manager, I was told, yes, Ken, you can do this pilot, but guess what? You're doing the rest of your work as well. So they did have a foot in both. And actually, it kind of worked out for us because they really, the critical change side, they got it. They loved working in that manner. And they started the communication back to some of the other projects and teams they were on, saying, well, why aren't we doing it this way? You know? So it worked out well for us. When we went to the LRL side, when you're talking, 180 some critical projects, we couldn't have people in both worlds very long. That's why we had the 2-year acceleration, where we got them into all critical changes as fast as we could.
So in secondary part of my question, so when you had them in both worlds, did you get them actually saying, no, I'm working on a critical chain task? Did you actually get them telling other people on other projects that weren't involved in critical chain efforts, saying that and applying some of the principles?
Yeah, but there's a fine line there. We did. There's a fine line there. We didn't want to prioritize our project necessarily higher than theirs, but we did make it very clear at the task level, hey, this other project wants me to do this, so we would ask questions, well, what if you don't do it this week? What's the impact? I know what the impact is to mine, and so we had those conversations. So yeah, we purposely did not say that you always focus on this project because it's a pilot. We didn't want to give the pilot like unfair leverage. Yeah, and people, even throughout the IT rollout, because the IT rollout did take a long time, there was a lot of complaints about living in both worlds. It's hard. It's hard for the project manager. It's hard for the management. So,
Any other questions?
Yes, how you doing? You mentioned that you guys plan really well. We have just introduced approximately 600 plans into our system this year. What would you recommend? Because you mentioned that you had one plan with 8,000 tasks. What would you recommend as far as to get a good, solid plan together?
well, for the long plans, like this 8,000 task one and some others, the key to us is what we call our next planning horizon on big projects. So our process is to get the key players that understand the work. We get them into this room for our network build, and we really focus on from now to the next key delivery or the next milestone, if you want to call it a milestone. That we plan in detail. So for some projects, this could be, or that effort could be a 6-month effort. It could be a year effort. But then what we do then is we focus on that, and as we learn from that, we get ready to plan the next planning horizon. As we get close, we do that. So what we don't do is try to put a lot of detail in an 8,000 effort plan all the way to the end. We've got something that we even use for archetype data, we call it. So if we're building a schedule now that's real early in like phase 1 clinical trials, we'll just say, out there the last part to launch is 400 days because it's just good enough for now. And this plan may never get out at phase 1 clinical trials. The real key to good planning, though, is a good facilitator doing this network build, good templates or modules to start with. The last thing you want to do is have physicians, scientists, toxicology people sitting in a room and start drawing box number 1, and end up with 4,000 boxes at the end of 3 weeks. So you start with good templates that they all understand. We'll have our clinical trial people really focus on their piece of the work, and then we'll have our toxicology people or our manufacturing people working on their piece of the work. And then the important part there is the linkages. Who's driving whom, who's driving the bus. It's probably some of the hardest work I've done as a project manager is building some of these things and working with these teams, but it's so impactful. Early on when we first started doing the critical change on the IT side, I remember one of the first network builds where we had to bring people in from other countries for this. Well, you talk about getting pushback. I'm going to pay these people to come here and blah, blah, blah. And my answer was, yeah, we're going to pay that expense now, for 5 days or whatever to build this plan. But what we're hoping for is a delivery date that's a whole lot more savings than what this is going to cost. And at the end of that very first one, every single person involved said, why aren't we doing this on all projects? Why aren't we planning this way? So that was a hurdle. If you're just starting out, that was a hurdle to get past, the time required to build a good schedule. Does that help?
Again, Ken's going to be around, and all of our presenters, please take advantage of the time and breaks, and of course, at our networking receptions to get further into it. Would you help me thank Ken for his insightful presentation, my new BFF. Great job.